Hi, I'm Chris Bridle.
And I'm Steve Laville.
We work for NHS Leeds West CCG, which stands for Clinical Commissioning Group. There are 3 CCGs in Leeds. They're responsible for planning and buying health services for local people.
An important role of the CCG is to make sure that the services we provide are as effective as possible. My role as Head of Planned Care Transformation for NHS Leeds West CCG is to make sure that the services we provide are affordable and effective. This means, occasionally, having to change or redesign services to make sure that they deliver the best possible service. We do this often as a result of feedback from parents or carers or patients themselves, as well as from healthcare professionals.
When we make changes to services or redesign services, it affects you. It also affects the people who care for you, your family and your friends. It's my job as the engagement lead to make sure that when we make changes to services, we listen to what patients, carers and the wider public say and act on the feedback that they give us.
We're making this film because we're about to make important changes in ear, nose, throat and ophthalmology community services. By community, we mean services that are delivered in local clinics and GP practices rather than hospital. We're also making changes in the audiology and hearing aid services, and we want to know what you think about them.
If you live in Leeds, these changes could affect you. You can tell us what you think by filling in the patient survey. There are a few ways you can do this. You can follow the link on the screen, or you can fill in a paper survey at your GP practice, or you can find us on YouTube, and there's a link in the description of the video.
So what are these services? Well, ENT is those conditions relating to the ear, the nose, the throat and the neck. Audiology is those conditions relating to hearing and balance, and related to that there's the hearing aid service, which looks at the provision, the fitting and the maintenance of hearing aids. And finally there's ophthalmology, which is the branch of medicine that looks at the function and structure of the eye, and particularly those conditions that affect people's sight. What we're looking for is the views of current and potential users of each of these services to find out what works well and those areas that we need to improve. For ENT, that's adults and children. For the other services, because the treatment and management of those conditions for children tends to be specialised and best delivered in hospital, we're looking primarily at the treatment of adults. Now, we don't expect to make major changes to each of these services, but we do expect that you'll help us identify a number of small, practical steps that will help improve the way that patients access these services and get better treatment and experience from them.
We want to hear your views, whether or not you use ENT, ophthalmology, audiology or hearing aid services. As Steve has said, we're not planning to make any major changes, but we want to hear what patients think of the way services are currently delivered. Once the engagement is closed, we'll look at all the feedback and we'll decide whether we need to make any changes to make life easier for our patients. If you leave your details after the engagement, we'll contact you to tell you how your feedback has helped to shape future services.
We hope this gives you a better understanding of why we're asking for your views and why it's so important that you get involved. Thanks for watching.
Goodbye.